On March 22nd, a group of women with endometriosis gathered in Oakville, west of Toronto, for the first Endometriosis Experience Exchange. The evening was an intimate, emotional, eye-to-eye, face-to-face sharing session, where women gave voice to the chronic and excruciating pain they have carried in silence since puberty, the heartbreak of infertility, the helplessness of seeing their daughters inherit the disease, and their frustration with the healthcare system that discounts the degree of their pain and symptoms. Patients were able to tell their endometriosis story, some for the very first time, chronicling years of gnawing, debilitating pain, misdiagnosis for years on end, and the anguish of infertility. Many spoke of endometriosis as a robber or thief, stealing their dreams of having children, their ability to live, work, and play pain-free, and ultimately their sanity. Patients learned there is no one voice or patient organization in Canada for women with endometriosis that can tackle everything that needs to be done: awareness, information and referral, lobbying, advocacy, and finding ways to institutionalize empathy and support from doctors, nurses, emergency room physicians, and society at large. Furthermore, gynecology in general, the women agreed, does not appear to be a priority, leaving endometriosis specialists to compete with other diseases for operating room time, better diagnostics and treatment facilities, and physician training. This leaves women with endometriosis out in the cold, often being accused by ER physicians and doctors of being drug-dependent hypochondriacs. This prompted a discussion about the power endometriosis patients have to change the system. That by sharing their stories, giving voice to their pain, and building a body of evidence about the burden of living with endometriosis, patients, doctors, and politicians can work together to create centers of excellence across Canada to treat endometriosis. Such centers, similar to cancer centers of excellence, would treat women as a whole, managing their mental, physical, and emotional symptoms with a team of gynecologists, oncologists if necessary, physiotherapists, social workers, as well as offering state-of-the-art surgical treatment options. The evening concluded with a forward-looking conversation about how to make these suggestions a reality. Everyone agreed on the power of the authentic patient narrative and shared understanding that if more women with endometriosis could share their story, speak their truth, and have their pain, infertility, and other symptoms validated, understood, and treated appropriately, whether through pain management and/or excision surgery to remove the endometriosis tissue, then our healthcare system and politicians might just listen. Then, and only then, would women with endometriosis get the respect and resources they deserve after decades of misdiagnosis, dismissive attitudes, and unbearable pain and suffering.